So a neuropsychologist is a specialty for testing and diagnosis of neurological and psychological disorders with cognitive effects or symptoms. An evaluation for neuropsychology tends to be a long process. There's an interview in which I get a good feel for what a person's concerns are, or review their medical records with them and find out what do they need to know and what do their doctors need to know to clarify what diagnosis is present or what's going on so that we can plan effective treatment. And then there's a bunch of testing that we will do. It can be paper and pencil testing, it can be questionnaires, it can be timed tasks and puzzles. Anything that your brain can do, there's probably a way for us to measure how you do it, how effective you are at it, and that can help inform what process may be going on in your brain or in your life that's affecting how you're functioning. Depending on the results, some diagnoses are things that we manage through adaptive practices or provide tools for you to change the way you approach things to be more effective. Some diagnoses are treatable and curable. Some things are not treatable or not curable, or we can at least do things to minimize the negative effects in a person's life. So it depends on the actual outcome of the evaluation and what diagnosis is made, what we will do to treat a person. Whether the answer is we can do a lot or we can do a little, there's usually something we can do to help improve quality of life and maximize your functioning for as long as possible. Rarely do people know they need a neuropsychological evaluation. Usually it's their psychiatrist or neurologist or family care physician that says, hey, we need more information and I'm going to send you to do some testing with the neuropsychologist so that we can clarify what the diagnosis is and what we need to do to address what's going on. There is not a typical patient. There are ones that come up more often than others. It's not uncommon to see people for attention concerns. That might mean somebody has ADHD, or they have anxiety that is causing poor attention, or depression that's causing poor attention, or sleep problems that's causing poor attention. So not only are we looking at how specific areas of cognition are functioning, we're trying to understand what is the underlying process that's affecting that. So just because somebody has memory difficulties does not necessarily mean there's a neurological disorder. Depression affects memory. Trauma can affect memory. So there's a lot of things that we need to do to differentiate these different processes so that we can best help somebody with what's going on. It is not uncommon in epilepsy for individuals who regularly have seizures to have cognitive effects from those seizures, because a seizure is a change in the activity of the brain, often caused by some structural change within the brain, whether that's because the way the brain developed or because of an injury. And in the course of treating epilepsy and trying to maximize people's day-to-day function so they can live happily, we'll test the different things that they can do, find out what their limitations are, and try to help provide some adaptive strategies or other therapies that will allow them to maximize their day-to-day functions. It's not uncommon for older adults to be concerned about changes in memory or attention. Some of those things are associated with normal aging, and there are things that can be in excess of what we expect with normal aging. And what we can do is compare how an individual is performing on cognitive tests to how they should be for the rest of the population and get an idea of, are they aging healthy, or is there another process going on that we need to be focused on? Trauma can be an emotional experience, and it can also result in physical harm. And some of the symptoms of PTSD and of brain injuries can mimic each other. And so it becomes important to distinguish between the two so that we know how to effectively treat an individual. It's not uncommon for there also to be both present, okay? And so there may be some emotional scars from a trauma and some physical scars from a trauma, and we need to address them both appropriately so that we can get a person back into a healthy lifestyle. I got my bachelor's degree at Brigham Young University. I then went on to get a master's degree and a doctorate at the University of Florida. I did a clinical internship at the Southwest Consortium at the VA in Albuquerque, New Mexico. Then I went on to do a postdoctoral fellowship at the VA in San Antonio. So I spent altogether, that was 13 years of schooling and training to get to this point. I've been seeing patients for 15 years because I was seeing patients as a student, but I got my doctorate in 2016. If you're interested in scheduling an evaluation to look at your cognitive abilities or look at your psychological functioning, reach out to your psychiatrist, your neurologist, or your primary care physician to put a referral in, and then we will call and schedule an appointment to get you moving